But I'm going to go first to Wadih Maalouf, who's joining us from Lisbon from a conference. And Wadih is representing the United Nations Office of Drugs and Crime. And Wadih, as you're all going to hear and see, is an incredible public health professional, originally from the Lebanon, with a PhD in mental health and drug epidemiology from Johns Hopkins School of Public Health. He joined the United Nations Office on Drugs and Crime, first in Cairo in 2006, supporting health responses to drugs in the Middle East and North Africa region. As of 2010, he coordinates a global programme on prevention of drug use, HIV and violence from his headquarters in Vienna. So Wadih, to come to you first, and greetings from here in Dublin, Ireland. I know that for your office and your team, you're working across 17 sustainable goals, and I don't expect you to speak to all of them today, but I know one of the core goals in there is good health and well-being. Can you just talk a little bit and set the scene for us when it comes to the United Nations Office of Drugs and Crime? How do you engage with and support policymakers?
Thank you very much, Oni, and thank you for the introduction and for having me on this interesting panel. As UNODC, as the Office on Drugs and Crime, we are an office that is specialized in the issues of drugs and crime at the service of member states. We are governed by two parliaments, if you want, of member states, decision makers in terms of your country is implicated. So one is on drug issue and one is on crime issues, where this committee, this parliament of member states sets the agenda moving forward in terms of priority of taking actions and put resolution in terms of how to address the challenges of drugs, the challenges of crime globally, and request UNODC's technical assistance as well as normative assistance and an assessment and maybe like assessment of the situation to address these issues. Now, under the drug portfolio, we advocate for health and human-centered response to drugs that is scientifically supported and balances, supply reduction with demand reduction measures, but also really focuses on maintaining access to substances on international control for medical purposes. So I sit within a section that really sort of work and responds to the member states on issues related to prevention, treatment, and rehabilitation as a section, responses for drugs. Mostly my work is on prevention, and under the prevention we have, so basically you can see that there's a very big political umbrella behind this. There are political resolutions that the member states have a commitment to apply, and they request assistance in terms of how to implement it. And in the field of prevention, this is where we sort of capitalize on this opportunity of having that affinity of member state to provide them with what the science is in terms of prevention moving forward. And as you have rightly mentioned, we are in an era now from 2015 to 2030 where countries are working on also beyond their commitment to address the drug issue on sustainable development. These are 17 different goals. Goal number 3 is on health. And there's a specific target on health that is 3.5 on strengthening prevention and treatment response to drug use. And it's an important secondary, but very important political gate of entry where member states realize that prevention of drug use is not only addressing a healthcare need or a human health need, but it is a core component of sustainable development of their own countries and the world. And within this umbrella, we just try to refocus their attention, that political momentum that exists, into a science-oriented. It's not anything that is done is prevention, but there's a science behind prevention, and we try to guide them by development standards of prevention so that policymakers, when they're engaged with this momentum moving forward, with that good heart moving forward, would know what works, what does not work, how, in what context, so that they have a more programmatic approach.
And Wadih, as you're trying to direct political attention to key priorities, it feels like in this moment we're living through something of a perfect storm, unfortunately, in some ways. We look at poverty, we look at cost of living, war in Ukraine, climate change, like so many different issues. Like, what are maybe some of the key trends? What are some of the key priorities that you're really focused on right now underneath that goal of health and well-being?
A very important question, Anya, because many times policymakers perceive that they have a mental state in terms of addressing drugs as the issue, but they don't have that larger perception that initiation to drug use is not a result of a personal free choice that, especially children and youth can say yes or no to. But there are vulnerabilities that exist at the individual level, from mental health challenges to cognitive development to reactivity to stress to genetic composition as a person. But that person also exists within layers, social, ecological layers, with families that might have challenges, with schools that have challenges, communities, peers that have challenges. But even these social structures also are in a larger vacuum. And this is the core of your question, Anya, in the sense of a family, of course, has certain priorities, a certain role to play with vis-a-vis a child, but a family also lives not in vacuum, but has a context behind it. Currently, that larger context around these social structures and around the individual, with the rising level of conflicts, economic strains, social inequalities, accessibility to drugs or lack of accessibility to substances for medical purposes, the COVID-19 pandemic, all of these things affect the individual with their own sets of vulnerability and affect the structures around them. So we try to reshift the policymakers' attitude rather than just discussing what drugs are, their dangers, which is a small slice of the problem, to really focus how to support the individual resilience and the structures around the child to grow in a healthy and safe way.
So to hone in now very specifically, Wadih, on the context there that you speak of drugs and substance abuse, I've heard and seen you say before that this does require an evidence-based substance use prevention strategies. It calls for a shift in what you call the response paradigm that focuses on the people rather than the substances. Can you talk a little bit about that philosophy?
Exactly. That's the core component, and I think it goes back to why strengthening prevention in that context is linked to sustainable development. Because now, when you're focusing on the person, because when you're talking about drugs only, you can talk with a specific age group, with a specific subpopulation of this age group. But when you're seeing holistically in terms of building vulnerability, building resilience against vulnerability at the individual level and the ecological layer around them, you're talking about safe development of youth, then you can start applying the science of prevention as early as when the child is in the womb of the mother. And there are intervention by then. And every single age of development, when the child is born but is unable to speak, can be supported in terms of have a positive socialization context. When the child speaks and is not yet in school as well, there's another set of development in terms of cognitive and other needs that maybe for the sake of this conference, I won't go into details, but there are packages that can support this. When the child is in early ages of school years, there's another set of milestones of development that can be assisted. And so basically you're starting addressing that vulnerability so early in the person and in the context around them, that in reality, you're not only preventing drug use, but you are building a stronger, more resilient generation that is, you're preventing violence, you're preventing school delinquency, you're preventing mental health, and so many other issues. And that's the core element in terms of that change of paradigm. The cost effectiveness and the return of investment on it becomes broader and is linked to sustainable development.
Yeah, so it's two-pronged. You're trying to prevent the dependencies in the first instance and helping people ensure that they don't develop those disorders. But that is in parallel to the holistic self then, as you say. I imagine in all of that, you're having to think about parents, Wadih. Like, it's been a core theme through this event over the last 3 years. On Monday, we had Parents Plus here speaking very, very passionately about peer-to-peer networks for parents. When you think about the parental support, can you talk a little bit about just, I know some of this might be for parents in crises and trauma, but I think the tools are still important and relevant to an Irish audience here, just how your team have gone about supporting parents, in particular those, as I say, in crises situations.
Yes, I mean, in the context that I just described, Anya, I mean, we're talking about, when you talk about development, you can appreciate that out of all the social institutions that I mentioned, family is a kind of a breed by itself, because the member of that social institutions share genes, share a history, share a future together, unlike any other a teacher or a social worker, where they have, an important role, but the their relationship with each other is different. So that's why in the context of development, we focus a lot on the family skills sort of development, family skills that adapt at different ages of development. And all families, as you mentioned, regardless of the context they are in, there's a certain, and just to clarify, because I'm from the Office on Drugs and Crime, we're not talking about families recognizing if their kids are using drugs and being law enforcement officers within the family, but we're talking about really the skills of communication, bonding, how to set limits, but contain a loving relationship with the child, that affection, that positive affection, how to communicate, to problem solve, and that will evolve in different ages of development. That's universally. All families can benefit from this, and we have tools to support family skills regardless where you are and the context that you're living in. But you zoom in on an important context now, we have a very large number of families that are, COVID-19 made us all parent under stressful situations, as I mentioned, but also there are parents that are facing particular challenges in terms of caring in conflict, in displacement settings, in humanitarian setting that might be linked to conflict, might be linked to climate, might be linked to social inequalities context. All of these things make the normal parenting shift to a different level of vulnerability where the caregiver themselves need to take care of themselves, and at the same time play a role of a safety net in children, where also these children are facing a vulnerability that is different than just the age of development they are in. So we have a set of tools for caregiving in such contexts, and these vary from simple things as tips, leaflets that parents can actually read themselves so that they would recognize their own stress, read the stress on the children, remember specific techniques that they need to account for in the context that they are in, to more detailed booklets where they can read them in more details, to packages that are more interactive in the sense of now we're no longer taking the parents themselves reading the skill. We appreciate learning a skill requires somebody to support you. So there are facilitators that can be trained, work with families in terms of really through play. The child on one hand appreciates what the skills are in the parents, and the parents, so the relationship is built through these packages. Strong Families, for example, is an example of a tool that's designed for parenting in stressful situations, up to, if you visualize it as a pyramid, of course, when we talk about crisis situations, there's trauma exposures, and trauma affect caregivers, affect children beyond just the normal stress of the crisis that they are in. So after addressing trauma, we have also packages that address trauma while at the same time rebuilding that relationship between caregivers and their children. An element of this is translational science, where we have documented that the developers of these programs exist in one country, mostly developed countries, where it has been researched, but we have worked also in terms of documenting that this sort of science exists and can be translated to the countries we're engaged in beyond this.